Hey, hello, everyone. Welcome to today's important session. We're going to talk about suicide awareness and the role of Get Well in supporting all patients. We know that suicide is a critical public health issue in the United States, significantly affecting individuals, families, and communities. Each year, tens of thousands of Americans die by suicide, making it a leading cause of death. Today's session will show how Get Well can be a crucial tool in offering immediate support and resources to not only veterans, but to all patients during hospital stays. And again, I want to remind you that we do have the chat open for those that are jumping on a little bit late, that's open, and we invite you to interact with us. If you have any questions or if you have a comment, please use that chat feature as we go through today's session. I am Jennifer Taylor. I'm the Director of Clinical Services at Get Well and your host for today. And I'm accompanied by two esteemed colleagues from the Miami VA Medical Center. And their extensive experience and achievements are so impressive that I'm going to have to read from my notes here from their bios. So we'll start with Jaime. Jaime has been a client success manager at the Miami VA for over 5 years. He came from Venezuela to St. Paul, Minnesota to complete his master in laws. And he loved the American way of living so much, he decided to stay in the US, and we're glad that he did. He has over 13 years of experience in healthcare, managing and implementing projects, training personnel, and overseeing client success. He has worked with multiple national hospital chains in Texas, Nevada, and Florida. While at Get Well, Jaime has been a mentor and trainer for several of our client success managers in the government sector. He's always willing to think outside the box and develop ideas and initiatives for his beloved Miami VA, and many of those being replicated across other government facilities. We're also joined by Kathleen Keeley. She is the local recovery coordinator in the Miami VA since 2016. She is certified in advanced professional practice for psychiatric, mental health, holistic, and rehabilitation care. Ms. Keeley has worked in mental health for over 30 years, including veteran hospitals in Omaha, Nebraska, Cheyenne, Wyoming, and Waco, Temple, and Houston, Texas. Her work has included serving as inpatient manager at an academic medical center, where she was recognized for leading highest performing inpatient units 2013 and 2014. As a Lean Six Sigma Green Belt, Kathleen is the Vision 8 Mental Health System Redesign Workgroup Lead, supporting ongoing projects which stimulate and sustain recovery focus. I want to thank you both for joining us today to share the work that you're doing to support all veterans. Our goal at Get Well has always been to help people take control of their health journey. As we start this discussion today, we are mindful of the sensitive nature of the topic and know that everyone may have different experiences and perspectives. On this slide, I want to share some important statistics about suicide death. The graph illustrates that from 2001 to 2021, suicide rates have unfortunately continued to rise among both veteran and non-veteran adults. The 2023 National Veteran Suicide Prevention Annual Report highlights a concerning figure. An average of 127.2 suicides occurred each day among U.S. adults in 2021. Within this, an average of 17.5 suicides involved veterans. Addressing suicide needs and compassionate approach that improves mental health care access, reduces stigma, and raises awareness about warning signs and prevention. Our goal is to provide practical tools and strategies for a caring approach in your organization. And now I'm going to go ahead and invite Kathleen and Jaime to share their impact.
Okay, great. All right, so good day. It's my honor to be here. Thank you, Jennifer and Jaime, for the invitation. Each VA has a local recovery coordinator whose role is to support the ongoing transformation to recovery-oriented care, which is the foundation of all of our mental health services. Next slide. Miami is within the Vision 8 VHA division, fondly called the Sunshine Network, consisting of 7 parent VA systems, including Bay Pines, Puerto Rico, the Caribbean, Orlando, North Florida, South Georgia, which has 2 healthcare systems, Lake City and Gainesville, Tampa, West Palm, and Miami. Together, we serve over 1.4 million veterans. Miami serves 60,000 veterans with over 40% utilizing mental health services. It's my pleasure to celebrate our partnership with Get Well Network. I was very fortunate to meet Jaime during one of our mental health awareness events in 2019. Being the warm, welcoming fellow he is, he shared with me the work that he does at the Miami VA. And within the year, he was regularly including announcements for our local mental health events into the Get Well Network feed. Once COVID impacted our local events, we included live links for access to virtual programs, such as our PTSD awareness recognition and Juneteenth celebration. Next slide. September is Suicide Prevention Awareness Month, as well as Mental Health Awareness Month. Mental Health Recovery Month. And on September 10th, the Vision 8 Leadership held a virtual conference for veterans, staff, and the public. Because of my relationship with Jaime, advertisement for this was shared across the Get Well Network. Presenters included our Vision 8 Network Director, David Isaacs, the Vision 8 Chief Mental Health Officer, Dr. Carrie-Ann Gibson, the Deputy Chief Mental Health Officer and the Vision 8 Suicide Prevention Lead, who is Janet Gates, amongst others. The message focused on our campaign of Don't Wait, Reach Out, emphasizing anyone can prevent suicide through connection and relationship. Repeating this message, Don't Wait, Reach Out, is really a key of empowerment for everyone for life-saving actions. Next slide. This event was recorded, so Jaime added this to the viewing options to the choices for veterans on having Get Well Network, and continues to be available and has had multiple views. Next slide. More recently, on September 24th, the Miami VA held its annual Suicide Prevention Mental Health Summit. This was hosted at our Bill Kling Clinic, which is a smaller venue than our regular hospital. And we had both Vision 8 and national leadership in attendance, so it was a pretty big deal for us. Hillary Peabody, the VHA national leadership, attended. She's the Assistant Undersecretary for Health for the Office of Integrated Care. We were very excited to be broadcasting this hybrid event as a live feed on the Miami VA Facebook page. On the Get Well Network, we advertised it through a screensaver. It had a reminder prompt, and it had the QR code for registration, allowing people to use their own smartphones or the Get Well Network to access the live event. Next slide. At the time of the event, a pop-up reminder aided persons to easy access this event. Next slide. So creating community connections through coffee socials is another action that prevents suicide. The Get Well Network continues to help us advertise our local coffee socials. These coffee socials are a place where all veterans are welcome. Advertising across the Get Well Network has increased visibility and attendance. Each week, we have new veterans attending the coffee socials, as well as some regular attendees that continue to really recognize how important the coffee social is to have a destination of friendly people in a safe place means a lot. And they've really developed a lot of strong relationships through these connections and have said it's really saved their lives. Next slide. So a point of pride at the Miami VA is our newly designed inpatient mental health unit. This is a 28-bed state-of-the-art unit, which now has 5 rooms offering access to the Get Well Network. As our highest level of mental health care within our organization, being able to provide the educational tools of the Get Well Network supports the staff in delivering a positive experience of care. In the 3 months since moving into this new environment, the veterans have enjoyed the additional entertainment options. And the photo at the top of this page shows our safely enclosed sets for use in this extremely safe environment. So that's a big lift to get the Get Well Network into that space. Training for all the staff on the all the unit staff to fully utilize the Get Well Network education is underway, and we are working on developing a welcoming video unique to this area of care and helping people recognize who's who on the treatment team, which can be a challenge. Miami VA has 3 residential treatment programs. One is currently undergoing updates, and we were able to include the Get Well Network in this new design. So that television is pictured here on the bottom photo of this slide. We are planning to add the Get Well Network to the 2 other established units soon, when we have the opportunity to do so. And thank you. I look forward to your questions, as Jaime has much more to share.
Thank you, Kathleen. Thank you for everything that you and your team do every day for the Miami veterans. I know they appreciate it so much. So when I met Kathleen, and we started talking about what we were doing with Get Well Network in the acute care units and the CLC units, she said something that stuck with me. You said something like, what we offer to one veteran, we have to offer to all the veterans. And from that moment, you fought to bring Get Well Network to the mental health units within the Miami VA, and you got it. You got it done. You had a mission, and I know it wasn't easy, but you and the leadership in the Miami VA, you guys made it happen. So now, the veterans in those units can see the fruit of all your work. So at the Miami VA, we have under the section from my care team, we have a tile called Suicide Prevention and Awareness. It has 5 different components. The first one is Stories of Recovery. It gives access to a couple of amazing websites. One is maketheconnection.net that provides a lot of information about mental health conditions, signs, symptoms, treatment options, resources, and also it has a lot of different stories about hope and help from veterans. The other site that we give access in this component is the National Center for PTSD website. Sadly, this is a common denominator for a lot of our veterans. So that site specifically provides a lot of information to understand this terrible item that veterans face every day. The second section is crisis lines. We give access to the Veteran Crisis Line and the National Suicide Prevention Lifeline. These 2 websites provide a chat option, a text option, and also a call option. So a lot of our veterans, sometimes they don't know where to look for help, and they don't know all the different resources that there are out there for them. So we try to put it, in their faces and in front of them, so they can get to these resources if they need to, if they're struggling. The third section is Start the Conversation, because the first step is the most important one, to realize that you need help and start those hard conversations. So in this component, we give them access to the va.gov Reach website that has a lot of content and a lot of different resources for veterans struggling. We provide helpful tips about firearm storage, medication safety, and information about compassion and support. Because a lot of our veterans, that's what they really need. They need our compassion and support when they're struggling. And then we have the online tools and apps that we have built a whole lineup of different VA sponsor apps for veterans to access through the TV. They can pull their smartphones and scan the QR codes and download those apps into their mobile devices. And last but not least, we have depression and stress. We have a lineup of 25 educational videos that veterans can watch at any time about these 2 important topics. Next slide. There we go. Okay. And here is just another list of different topics that we cover with our resources and content department. Some are very unit specific, for example, for dialysis units or the ER units. Some are more content based, like COVID, whole health, tobacco cessation. And I just want to, mention something. Our content is very customizable. It's very easy to mix and match. So what we have in one BA, we might not have it in another. Same for our commercial accounts. If you see something that you would like to see in Get Well Network, that you would like your audience, your patients to see, please let us know. That's why the client success managers are here for. To get the feedback and let us know what you want the system to do. And our system is great at doing that. So we having a lot of the elements that we have incorporated in our system is because somebody like Kathleen, approaches us and say, hey, can you do this? Can we add this? And then, we make it happen. And a lot of these tools and resources that we have, they're automated. They don't need input and they don't need the nurses to do anything. A lot of them, they run at a specific time and they're so user-friendly that veterans can play and really get the most out of them. Next slide. And this is just an example of how the mental health team at the Miami VA are using another platform that we have. It's called Rounds Plus. They have a survey that they run for all the patients in the residential and rehabilitation treatment program. And we have gotten great results. First, it asks them, what kind of program they are, PTSD, and the other two programs that they have. It also asks them in which stage of the program they're in, at the beginning, the middle, or the end. And then it tries to gather feedback of how we're doing as a program. Are we providing the necessary tools? Are we listening to them, to their needs, etc.? Do they feel that they can trust the staff to get to where they need to be? And after a year of data, and then we start analyzing all the different results, we realize that the deeper they are into these programs, the responses were better. So that means that they will trust the staff more, they will feel more comfortable with the programs, which was very nice to see that the longer they were with us, the better the results were. So this is just another example how the mental health team is using the tools that we have, for them to really get the best out of Get Well Network. Next slide, and I think that's it. Now we're open for questions.
We're open for questions. Thank you both, Jaime and Kathleen, for sharing your work there at Miami. There is, let me see if any questions are here. Robin has something there. She's talking about the survey, the question on your survey, and just saying that she loves that question. It says the physical systems, electrical, plumbing, washer, dryer, TV on the unit function as intended and requested work orders are resolved in a timely manner. Maybe tell us a little more, Jaime, why that question is on there.
Well, because with the residential program, we want to make sure that they feel at home, that they feel that when they're at the Miami VA, they feel that any issue that they have with the rooms, with the facilities, we want to make sure that we address those issues accordingly and timely. So we want to make sure that that's a big satisfaction issue, with the veterans. The least that we can do is give them a proper environment that they're not having plumbing issues or, AC issues or things like that.
Yeah. Kathleen, I see you nodding. Would you like to add anything there?
Yeah, sure. We have regular stakeholder meetings that include select veteran representatives from each of the groups that talk through and make sure that, any issues are timely reported. But still, there's veterans that may not feel comfortable speaking up or are just, maybe shy. So this other alternative to getting feedback through using the Rounds Plus adds another layer of opportunity for them to feel comfortable in sharing their point of view. And, we've got a lot of property. So, having the veteran who's using the space every day report it when things are not okay helps us to get it addressed much more quickly.
Yeah, I could see that. You probably have notifications set up. So as soon as they respond to that, you're able to see and take action as needed. Yeah. Perfect.
Yeah, it's been really meaningful. The Rounds Plus was just like a godsend because nationally they want us to get feedback from the veterans while they're in care. And so this really worked hand in hand to meet the expectation that was being set nationally in an easy way. It's just phenomenal. And like Jaime mentioned, it's very customizable. We can give him the questions we want to be asked, and he puts them in a tool. It's just really remarkable.
Yeah.
We're hoping to do more of that, even on the inpatient unit.
Yeah, that's a very good point too. And Jaime, if there's somebody listening that wants to add maybe any of these features or wants to talk more about it, how should they go about doing that? What's the best way to do that?
I think they have to add more features. They have to reach out to their client success managers. Every facility has one. And the good thing within Get Well Network is that we all share what we're doing. So, and everything, it's like I said, it's customizable, and you can replicate what a hospital is doing in another. It's very easy. So just ask, like this morning, for example, I got a call from the pharmacy chief and say, hey, we want to do this. What do you have that we can use to tackle this issue? And then, we already get the ball rolling on that. So that's the first step. Ask your client success managers, and if they don't know the answer, they will ask the other CSMs and get the answers. And we share, we help. And if somebody needs to jump on a call with another facility, we're more than willing to do that.
Great. And to let everybody know, this is a VA success story that we're sharing today, but this is available to all organizations, all facilities across the country. So this is not just specific for VA patients only. Michael says veterans need to feel empowered. We have regular meetings of the CLC resident council meetings here at his location. I'm not sure which location he's at. And then we have a comment from Jay Allen, and it says, Kathleen, please email me. He wants the details of the BHICU install of TVs and Get Well access. He totally agrees with the imperative that all veterans under our care should have Get Well available regardless of security levels.
Thank you. I'll be happy to.
And Robin says this is also available for commercial hospital facilities as well, not only VA. Yep, saying that again. So are there any other questions from
I actually posted a
audience?
question above that,
Okay.
Jennifer.
Are there any plans? Okay, so I see it. Are there any plans to make changes to what is currently being offered? Will you be adding additional resources or educational content?
I will say at this point, yes, because, the needs are always changing, and there's always new ideas. And that's something that I love about from the team at Miami. They're always trying to see, okay, what can we do better? What can we do next? And yeah, there's always, like Kathleen mentioned, we're in the works of making a welcome video specific for the mental health units. We are working on a tailored education. So we're going to create a bundle. We have the 25 videos that I mentioned, but there's some other videos that they want to add to make it, to tackle specific lines of patients, etc. So there's definitely a lot of work. The main goal was to open the unit because it was such a long process with whoever works in mental health and have tried to open a mental health unit knows all the different things that you have to be aware, to make sure that the patients are safe and the staff that works in the units, they're also safe. So yeah, there's definitely a lot more to come.
Kathleen, would you like to add anything?
Yeah, I love what he mentioned. We're very excited about the idea of creating that unique video presentation that will be the people that will be actually working with the veteran across that hospital stay. So, that increased familiarity and standardizing kind of that intro package to help the ease of the direct staff is very meaningful. I think one of the things also, I know that, it's kind of a long range idea, but with the Get Well network, it allows kind of that closed circuit opportunity. So there could be potential for, visitation, the electronic visitation that way. Also providing, across the 5 rooms that we have the Get Well network operational on the unit, we could actually be presenting the same content in all 5 rooms at once if we needed to be, since, we could have up to 28 patients. So it's difficult to have all of that population in one room. So having that, those various options is very meaningful. So lots of ideas that we have that just given time and opportunity that we hope to develop further. So, but Jaime's such a visionary. It's been really cool to work closely with him and just seeing the resources that we have available that may go untapped if we don't know about them.
Yeah, agree. Robin also made the comment, I can see space for substance abuse and treatment options and resources to be available as sometimes individuals seek non-healthy coping methods.
Yeah, and certainly that's a big platform of the unique individual work that's going on the unit. And so that extra layer of virtual information can be really meaningful. The VA has a lot of resources that for education for the providers as well as for the veterans. And so connecting those two things will add additional recognition of the tools that they have when they leave. Like what Jaime mentioned about the apps. That is fantastic work that's going on across the VA. We've got several different specialty cohorts that work specifically on the certain topics as the SUD and provide resources for veterans to utilize. But again, if the veteran's not aware that they're there because of timing and delivery of the message, it might go unused. So anywhere we can add those layers of information is really meaningful. And that, sometimes you have to see it like 5 different times in different ways for it to actually kind of strike something that you see would be helpful to you. So the apps is a huge piece that we want to, continue to popularize.
You talking about apps too, Christine said, my apologies if you already said this, but is this well suited for outpatient settings? So maybe the app is something that would be utilized for outpatient.
Yeah, so that's a great question. So has the Get Well network at this point in time at Miami is not set up in the outpatient setting area that I'm aware of. Mr. Brito might know differently. But it has been discussed, and I know I've surveyed across the nation the local recovery coordinators, and I believe there are some pockets that actually have implemented some Get Well information within their waiting rooms and use that as kind of their waiting room entertainment, right? So then that gets some of that education out. But the apps can be used by anyone. They are not exclusive to the VA. They are created within the VA. But same as the Make the Connection videos. Those are created by the VA, but they are available for anyone. So many of the tools, many of the resources are customized for everyone that may not be in the federal programs. Let's see. So I'm not sure if I answered that question, but certainly the Rounds Plus would be something that could be used easily in the outpatient areas as maybe a survey or a tool to gather information.
Yeah, great. All right. If there's any other questions, we will have a survey at the end. Christine says thank you. So I think you answered her question for her. If you want to drop, your questions in the survey, you'll be able to do that also. So we'll just close with inviting you to join us for December 4th for our next Get Well Wednesday. We'll be talking about guided care in action, and this will really be talking about preparing patients for a procedure, which will reduce, those cancellations and make sure that patients are well prepared for the procedure that they're coming in for. Invite your colleagues to join us. If you've missed a previous Get Well Wednesday or want to sign up, you can always go to our Connection Hub. It's at getwellconnect.com. I want to thank you both for sharing this information with us. This is great work, and we're so happy to be a part of that and be able to share it out with everybody. So thank you again. As we conclude our webinar, I just want to thank you all for participating and engaging with this important topic. In conversations like this, we really believe will drive change and can save lives. So really great topic, and thank you again. All right. Thank you, everybody. That concludes our Get Well Wednesday for today, and hope you have a great rest of your day. Thank you so much.